Hello everyone, I am Dr. Manjinder Sandhu, Medical Director and Director Cardiology at Artemis Hospital. Today I am going to tell you about disorders of the heart rate and rhythm. As most of you have heard that disorders of the heart are mainly related to heart attacks or what we call as coronary artery disease. But there are other disorders which affect the heart rate and rhythm, and these can result in either fast heartbeats or slow heartbeat. Before we proceed further, I would like to explain to you the electrical system of the heart. As shown in the diagram, the heart has its own pacemaker, which is located in the sinoatrial node. This happens in the smaller chamber of the heart, the right one, the right atrium as we call it. The impulse starts from there, then it goes to another node at the junction of the small and the bigger chambers, and then it spreads into the heart down below. So any disorders in this conduction system can result in fast heartbeat or slow heartbeat. So if we take the disorders of the fast heartbeat, many people have an extra pathway, as we call it, of the current to pass in the heart as shown in the diagram. Sometimes the current goes down by this accessory pathway and then comes up by the normal pathway and thus causes fast heartbeat. This is a very common disorder. It's called as paroxysmal supraventricular tachycardia. And patients typically complain of a rapid heart beating or fluttering of the heart, and sometimes they may feel a little bit dizzy and weak. When this kind of a arrhythmia comes up, the fast heartbeat, patients may feel a fluttering or a rapid heart beating, and sometimes they may feel dizzy and weakness. In such instances, it's important to immediately rush to the hospital, get your ECG done, and if it shows that this paroxysmal supraventricular tachycardia is happening, then the doctor gives you an injection which makes it all right. It's nothing to be scared of. It's a very common thing, happens to many people. So initially we keep the people on medicines, and if despite medicines this arrhythmia keeps on recurring, then we have to subject the patient to a procedure called electrophysiology study and radiofrequency ablation, abbreviated as EPS and RFA. In this procedure, we put catheters, 3 or 4 of them, through the veins into the right side of the heart. We first stimulate the heart to reproduce the arrhythmia, and then we try to localize it by seeing the electrical signals being generated and captured by these catheters. As you can see on the TV screens, on one screen we are showing the catheters inside the heart and how we stimulate them, and on the other screen you can see the electrical signals being generated. And once we localize this pathway, we put a radio frequency burn out there, so which makes this pathway incapable of conducting electrical impulses, and thereby the arrhythmia is cured. So there are many kinds of arrhythmia. What I am talking to you about is the commonest one, the PSVT as we call it. However, there are other arrhythmias which may start either from the smaller chambers or from the bigger chambers. Most of them are amenable to the same treatment, which we call as EPS and RFA. Coming to the disorders of slow heartbeat, you can just think of the pacemaker of the heart going old and as a person ages, and so the impulse formation also slows down, and this results in slow heartbeat. Once a person starts having a slow heartbeat which is very slow to cause pauses, so that's the time, and he's also feeling at times dizzy or giddy or blackouts, that's the time when we put inside a pacemaker. A pacemaker is, simply speaking, a pulse generator, as you can see out here. So this is a pulse generator or the pacemaker. It has a lot of advanced circuitry inside it, and we place it under the left collarbone. Usually we make an incision into the skin and put it there inside. To this is connected the lead which goes inside through the vein which carries the blood from the arm to the heart, and this lead then goes inside the heart, and as you can see the tip has got tines, and these engage in the muscular trabeculae inside the heart, and the lead remains inside, and the pulse generator generates the electricity and the lead paces the heart so that you can have normal heartbeat again. There is another common condition which we call as sick sinus syndrome, in which sometimes you have slow heartbeat and sometimes you have fast heartbeat. In that circumstances, we put the pacemaker in first and then we give medications to control the fast heartbeat. Otherwise, if you don't put the pacemaker in, the heartbeat may become too slow. So these are the common arrhythmias or disorders of the heart rate and rhythm. There are many more, but most of the treatments remain the same. That is either electrophysiology study and radiofrequency ablation or putting in a pacemaker. Pacemakers are also of many types. We have a single lead which I have shown you. There are double lead pacemakers and pacemakers which are MRI safe nowadays, because this is made of metal. We have pacemakers which are MRI safe, and with them you can get your MRIs also done. And also we have now long life pacemakers which can last 15 years. Usual life of the pacemakers is around 10 years. And we also have a pacemaker called the Micra, which is very small as shown in the photograph. And this pacemaker does not require this kind of a surgery, minor surgery. It can be just put through the vein in your leg right inside your heart, and it remains there and paces there. So in case you have more questions, you can contact me on my Facebook page and I'll be happy to answer them.